Communities all across the state are benefiting greatly from the work of our community substance abuse prevention coalitions. Thank you very much for your ongoing support of prevention in Tennessee.
Electronic nicotine delivery systems, or ENDS, have many names like vapes, electronic cigarettes, e-cigs, e-hookahs, mods, and tanks. Regardless of their name, ENDS contain a liquid nicotine that is an addictive stimulant. Nicotine is a highly addictive drug and can change how a young brain develops. Thank you.
Stephanie Janko from Prescott South Middle School. While aerosol from ENDS is presumed to be less harmful than secondhand smoke, a recent study measured levels of potential e-cigarette pollutants in a ventilated room while volunteers consumed e-cigarettes with and without nicotine and found a change in air quality.
Tennessee has a history of protecting its citizens, particularly its youth, from the harmful effects of secondhand smoke inhalation beginning in 1994 with the Prevention of Youth Access to Tobacco Act and the Children's Act for Clean Indoor Air. Further legislation followed for smoke-free state buildings and gave opportunities for hospitals, colleges, and religious institutions to determine for themselves whether to allow smoking on their campuses.
There are rumors that vaping is a healthy alternative to smoking tobacco, but this has not been proven. In addition to the health risks those who use these products face, there is another concern for the secondhand vapor and aerosol it produces.
I'm a high school student. I'm a senior, and Delta 8 concerns me because it's easily accessible to anyone without an ID when you're going to a gas station.
Unfortunately, under current Tennessee law, municipalities are preempted by state law and are unable to decide for themselves whether stadiums, playgrounds, picnic areas, entrances to buildings, venues, etc. should be smoke-free zones. These facts have prompted local advocates to seek stronger standards to reduce the exposure of children, youth, and non-smoking adults.
I'm a student at Cookville High School, and I think vaping is a problem because it doesn't only affect your physical health, it also affects your mental health and it affects everybody around you.
It is a psychoactive substance found in cannabis sativa plants, of which marijuana and hemp are varieties. A common misconception is that Delta 8 is like CBD and hemp products, but it actually contains THC, similar to Delta 9, that causes the high people report when using marijuana.
There's no age restriction to purchase Delta 8. It is falling into the hands of our youth. Delta 8 is often packaged in a way that appeals to youth, like edibles, gummies, fruit-flavored snacks, chocolate, and infused beverages.
Delta 8 has also not been evaluated or approved by the FDA. Since Delta 8 isn't regulated, there is an increased risk of damaging substances that may be in Delta 8 products. Some of these substances may include heavy metals, solvents, and pesticides. Thank you.
The National Poison Control received 661 reports on Delta 8 exposure between 2018 and 2021. 77% of those were unintentionally exposed to Delta 8, affecting patients younger than 18, and the majority of them experienced adverse effects like vomiting, hallucination, trouble standing, and the loss of consciousness. Thank you.
Selling unapproved products with therapeutic claims is not only a violation of federal law, but also can put consumers at risk, as these products have not been proven to be safe or effective. This deceptive marketing of unproven treatments raises public health concerns because patients and other consumers may use them instead of approved therapies to treat serious and even fatal diseases.
While cigarette smoking has decreased among teens, vape use is higher than ever. 20% of students in Putnam County report using a vape in the last month. Flavored tobacco products and marketing schemes make these addictive products extremely appealing to youth.
There's currently no federal minimum age to purchase Delta 8, but 18 states have passed laws restricting or banning Delta 8. Several other states are reviewing its legal status now. Although some retailers may require customers to be 18 or 21 to purchase, Tennessee as a state has no restrictions for minors to purchase Delta 8.
10 patients who are prescribed an opioid after surgery end up using them long term. The CDC states that one of the first actions in decreasing opioid overdoses was to improve opioid prescribing. One great way to reduce opioid prescribing is an alternative pain treatment for those experiencing chronic pain.
Natural does not always mean safe, but there are several complementary and alternative medicine therapies that have been evaluated and found safe and effective, like acupuncture, yoga, and meditation, to name a few. Scientific evidence suggests that some of these methods may help people manage chronic pain and therefore be an alternative to opioids.
Data suggests that alternate pain relief is both cost-effective and improves the patient's experience. The effort to make CAM more accessible could reduce substance abuse disorder, increase the effectiveness of pain treatment, and increase access to care.
Thank you.
Thank you.
Thank you. Thank you.
Thank you.
Thank you.
Thank you.
Thank you. Ready?
Thank you. Thank you.
Thank you.
Thank you.
Thank you, Tennessee General Assembly, for your support of prevention in the state of Tennessee. It truly makes a difference.